Just make sure you stay in.
Stay in the zone.
Hi, everybody.
Hi.
I'm Chanel Trevolini from Patient Safety Solutions, and I have Anne-Marie Bichello here with me today, who is a certified wound ostomy continence nurse, and we are going to be discussing her role and have a couple of good questions, I think. And I thank you for joining us.
I thank you for the invite.
You're welcome. So we're going to get started, and we're going to talk with Anne-Marie about her role as a certified wound ostomy continence nurse. The first thing I want to ask you is, what pathway did you take to become a WOC nurse?
Well, the pathway that I took, after becoming a bedside nurse, the organization that I worked for had an extremely good WOCN nurse, and she started a Skin Champion program, and that's what piqued my interest in wound ostomy and continence care. So once I became the Skin Champion for my unit, I decided to look into where I can go to school, and I asked her advice, and she recommended Emory University, which is where I went in Atlanta. I did the online program, and that's how that was the pathway that I took.
Okay. And so you did the program at Emory, and then you had to take a board certification, right?
Yes.
And you had to take more than one, correct?
Correct. So the program at Emory is a year online, and then there's a week they call the Bridge Week, where you go down and you meet your cohort, and you do a lot of hands-on training. It's full days every day, and then they prep you sort of for the test or the tests. And when I came back, I took my wound ostomy and continence, 3 separate certification tests.
One for each specialty area,
One for each specialty
correct?
area, yes. But before you do your certification exam, you have to have your precepting hours, which is 120 hours for each section, wound ostomy and continence, and you need to have 2 different preceptors so that you have a better overall scope from of wound ostomy and continence nursing.
Okay. That must be pretty exciting to now be board certified in a tri-specialty area of
Yes.
nursing.
Yes.
And so you get to use the credentials of CWOCN, correct?
Correct.
That's very cool.
Yeah.
All right, the next question I have for you today is, have you noticed any emerging trends or patterns in your role that are happening with the WOC nursing role since you've come into this field?
Yes, I see a greater need for WOCNs in the acute care setting, and I'll tell you why. The reason is that we today have a lot of accelerated nursing programs, and in these programs I don't think that enough time is spent in wound ostomy and continence care. And on the other end, we have our patients that are coming into the hospital are older, sicker, staying longer. We have a lot of ways in which to keep people living longer these days than we've had in the past. And so we have these 2 dynamics coming together. We have nursing that's not so educated in the wound ostomy and continence field, and we have patients that are in need of wound ostomy and continence care, and so that puts us at a greater need as educators to take these new graduates that come out of school and train them in the appropriate way to be, as we would say, a little minion of ourselves, where they can independently think and decide what we have shown them, what kind of dressing to use, what kind of prevention, how can I advocate for my patient, is my patient on the right bed, should I order a different bed, should I order them an overlay, all of these things that nurses come out of school and have no idea about. This is where we play an important role in their education and an important role in patient care and safety, and obviously for our organizations that we work for.
Yes, very well said. The next thing I wanted to ask you is, so with these patterns and trends that you're talking about, do you see that the WOC nursing role is really evolving as a result of that? Is that
Yeah.
causing any changes in the role?
Yes, I think that it's giving us a bigger role, and we need to definitely have a bigger seat at the table, with leadership.
Yeah.
Because everything today is about what we're doing at the bedside. How are we keeping our nursing safe at the bedside?
Yes.
So WOCNs play an important role in patient safety devices that are used to help nurses mobilize a patient, but yet nurses do not get injured on the job. Nurses move between 2,000 and 3,000 pounds a shift, a 12-hour shift. So if we could make and that leads to a lot of back, shoulder, neck injuries.
Mm-hmm.
So today there's a lot of different devices that we use in nursing to help the nurse not sustain an injury like that and to safely move the patient at the same time. So that's one thing. The other thing is that we play an important role in reducing pressure injuries in the hospital setting, right,
Mm-hmm.
through prevention. So in turn, that preventative measures and not causing harm and pressure injuries to
Mm-hmm.
a patient reduces the liabilities that we have legally, okay, for pressure injury that we cause in a hospital-acquired pressure injury.
Mm-hmm. So it really helps with decreasing litigious problems associated with harm.
So, right. And besides that, we are natural educators to,
Mm-hmm.
Our nursing staff, where we teach them how to provide this safe patient care, this preventative measures, how to be an advocate.
Yeah.
I think that's another thing that WOCNs, we are advocates for our patients. I could walk into a room and I look at a patient and I say, we should do this, that, just be preventive.
Mm-hmm.
We should put a sacral dressing on, we should put heel dressings on, we
Mm-hmm.
should use different device to help turn this patient. So all of that, you learn from your environment. So
Mm-hmm.
if your environment is preventative measures that are being done at the bedside, as a nurse, you learn to pick up on those cues and you follow what you've been shown to do in the correct manner.
And that actually leads me to the recent posters and abstracts that you've done. You've actually done a lot of that in your
Yes.
hospital, and you've been able to not only and I'm going to ask you to share a little bit about that, but I also want you to share with us what you're doing then with that information you're sharing, where you're sharing it at.
Oh, okay.
And that sort of thing.
Okay, so when I first came to this institution, we had a very high rate of HAPIs, which is hospital-acquired pressure injuries in our
Mm-hmm.
ICU. So looking at what was going on, I said to myself, we need to be more preventative in this.
Mm-hmm.
And what I did was I put down a couple of listings. What can we do? First thing I thought about was whoever comes through our doors in the ICU, whether they have breakdown or perfect skin, we are going to apply a 5-foam dressing with a Braden score of 18 or less. Okay.
So using a prophylactic 5-layer foam.
Using a 5-layer foam prophylactic on the sacrum, that was number 1. Number 2, if they were immobile, they were put heel boots
Mm-hmm.
on, so we could offload the heels.
Yes.
If they were unable to reposition in the bed, we used a overlay.
Mm-hmm.
Okay, so with a positioning pillow behind them, so it was easy for the patient to be turned and easier on the nurses.
Very
because the nurses can use, the overlay has handles where they can easily roll the patient with from side to left to right, or and put the positioning pillows underneath. Another thing that I did was leadership rounding.
Very good.
Myself and the manager of the unit of the ICU, we rounded every day to ensure that the nurses were following the directions that were, they were instructed to do for their patient. That was another thing that we did. So we saw a 30% decrease in the first 6 months.
Wow.
By doing all of this. But it's the fact of being proactive, being advocating,
Mm-hmm.
thinking ahead, using your critical thinking skills to say, wow, gee, what could happen here? Like, why would I put a foam 5-layer dressing on someone who has 18 or below braided? Is because, we're in an ICU. I've seen so many cardiac arrest cases wind up with a DTI.
Mm-hmm.
So maybe we could avoid that,
Yeah.
from, compressions, and their sacral bone is being friction and sheared on the bed from, our intention is to save their lives, but in the long term, sometimes we wind up with an injury that was unintended.
Yes,
You know.
of course. And so where have you, so you wrote this information up as an abstract, right?
Yes, I wrote it up as an abstract, and I submitted it to SAWC. I submitted it to NTI for
Mhm.
critical care nursing, and I submitted it to WOC Next 2019, and was accepted all 3 places, and I'm
Very
very excited
nice.
to be going to all 3.
Yes. And sharing your best practice.
Sharing my best practice, and that's exactly what it is. I think that's what WOCNs know how to do best practice.
Mm-hmm.
Yeah.
Yeah, that's so exciting. I'm very happy for you, and you get to go and travel all over the country to meet other colleagues.
Yes,
and
learn and
learn
share.
from them and
Yeah.
share your work with them. And that's also one of the things that I really love about being a WOC nurse is that collegiality and learning from best practice. And so the last question I have for you is, if I had a magic wand to hand over to you, what would you change in order to maximize your impact on your WOC nursing role?
If I had a magic wand, I would like to magically position myself in a seat at a government agency or in front of Congress, so that I can tell them, you don't really understand what nursing is all about, especially WOC nursing. We have right now ostomites that need supplies, and we give them supplies when they leave here. They go home, and the insurance companies only allow them 20 bags for 30 days.
Yeah.
That is a big topic that needs to be addressed.
Sure.
They should have 40 bags for the month,
Uh-huh.
not 20 bags.
Yeah.
So, that's something that has to be brought to light, and I think that if we can get one congressman to follow us around for the day
Mm-hmm.
and see what it's nursing and WOC nursing is all about,
Yeah.
maybe that would reflect in giving patients better care once they go home.
Mm-hmm.
More, not having to worry about their supplies. See how important our role is in an acute care and outpatient setting.
Very well said. I agree with you 100%, and I think that should be something that maybe we should work on, getting somebody with some political clout to kind of follow the nurses around, specifically the WOC nurses, and really see what they see.
Right.
Because it's their family members.
That's
It
right.
might even be them that are being cared for by the WOC nurse. So I thank you for joining me
welcome.
today, and
It's so nice to be here.
It's so nice to be here. And I just want to let you know that you can catch more of my interviews on my YouTube station, Patient Safety Solutions, and my website, patientsafetysolutions.net. And I will leave you at that. Thank you so much. Till next time.